Hypertension management. Key updates for pharmacists. Hey, future pharmacists. It's Osama, your friendly neighborhood pharmacy enthusiast, here to break down some essential hypertension updates. We all know hypertension, or high blood pressure as it's commonly called, is crazy common, like seriously common. And as pharmacists, we're on the front lines making sure our patients are getting the best possible care. That means staying up to date on the latest treatment guidelines is super important. So, what's new in the world of hypertension management? Well, the guidelines have been tweaked, and we've got a new target blood pressure to aim for. Plus, I'm going to be giving you the rundown on the first-line medications you need to know. We're talking essential info that will not only help you ace your exams, but also prepare you to be a rock-star pharmacist. So, grab your notebooks, get comfy, and let's dive right in. The target lower than you think. Alright, let's start with the most important update, the target blood pressure. According to the 2023 hypertension guidelines, we're aiming for below 130 over 80 millimeters of mercury for most adults with high blood pressure. That's right, even lower than before. Why the change? Well, studies have shown that getting those numbers down really makes a difference in reducing the risk of some serious stuff. We're talking heart disease, stroke, kidney problems, things you definitely don't want to mess with. Now I know what you're thinking, lowering blood pressure is important, we learned that in school. But here's the thing guys, achieving and maintaining this new target is absolutely crucial. It's not just about handing out meds, it's about working with patients to make lifestyle changes and really manage their condition long term. So, remember 130 over 80 millimeters of mercury, that's the magic number we're shooting for. First-line fighters, ACE inhibitors and calcium channel blockers. Now that we're clear on the target, let's talk about how we actually get there. When it comes to first-line medications for hypertension, two classes reign supreme: ACE inhibitors and calcium channel blockers. First up, we've got ACE inhibitors, like our good friend lisinopril. These little guys work by chilling out those blood vessels, making it easier for blood to flow. They're especially helpful for patients dealing with diabetes or kidney disease. Next, we have calcium channel blockers, with amlodipine being a popular choice. These meds work a little differently, relaxing both the heart and blood vessels. They're often the go-to for older adults or those with a need for speed, I mean those with high heart rates. Now, I know what you're thinking, which one do I choose, ACE inhibitors or calcium channel blockers? Well, it's not always a one-size-fits-all situation. The best choice depends on the individual patient, their health history, other medications they might be taking, and even their lifestyle. That's why being a pharmacist is so cool. We get to use our knowledge and expertise to tailor treatment plans and find what works best for each person. Chapter 3. Hypertension management, don't fall for these traps. Alright, so we've covered the target blood pressure and the first-line medications. But here's the thing about hypertension management. It's not just about popping pills. We need to make sure our patients understand that lifestyle choices play a huge role too. And you know what? Sometimes, even with the best intentions, people make mistakes. So let's talk about some common pitfalls to help our patients avoid them. First up, skipping doses. Look, I get it, life gets busy. But skipping doses can throw blood pressure for a loop, leading to those dangerous spikes we're trying to avoid. We need to emphasize the importance of consistency. Next, we've got the sudden stop. This one's a big no-no. Stopping medication abruptly can cause blood pressure to skyrocket, which is the last thing we want. We need to educate patients about tapering off medications safely under the guidance of their doctor. And last but not least, let's talk about lifestyle. It's not all about meds, people. Diet, exercise, stress management, these things make a world of difference. We need to empower our patients to adopt healthy habits that support their overall well-being. Chapter 4. Conclusion and call to action. So there you have it. BP less than 130 over 80 millimeters of mercury is the target, and ACE inhibitors or calcium channel blockers are key treatments. But now I want to hear from you. Which first-line hypertension medication do you see prescribed most often, and why do you think that is? Drop your thoughts in the comments. If you found this helpful, don't forget to like, subscribe, and share for more pharmacist insights. See you next time. Outro: stay informed, stay awesome. Alright, future pharmacists, that's a wrap on hypertension management. Remember, staying updated on the latest guidelines and treatment options is key to providing top-notch patient care. Keep those brains hungry for knowledge and never stop learning. Now go out there and make a difference. This is Dr. Mike, signing off.